Assessing the MHPSS needs and strengths of people affected by an emergency and mapping existing services and resources are essential parts of community-based MHPSS programs. It is critical to include community members in each step of the process. Assessment and mapping should not only list problems, but help to understand the individual, familial, social, and political factors in emergency response and how these affect the mental health and psychosocial well-being of crisis-affected populations. In this module, we'll look at general initial MHPSS assessments. Other assessments regarding specific activities, such as market analysis for livelihood interventions, are detailed in their own dedicated chapters of the manual. The main aims of MHPSS assessments are to learn about MHPSS concerns created by the emergency and how these are being addressed, identify existing social, cultural, and professional resources that can address psychosocial issues, identify existing structures for referral, particularly for those affected by mental, neurological, and substance use disorders, identify and provide special protection to groups excluded from or stigmatized by the community, and collect baseline data to measure the program strategies, activities, outputs, and outcomes. To meet these aims, MHPSS program managers should follow 8 steps. We will go deeper into each of these.
Step 1. Coordinate with other actors. Assessment should be coordinated with other agencies and actors in the field. This includes other agencies involved in MHPSS activities who may be found through any existing MHPSS working group. Other humanitarian actors, including the cluster system. This is important for facilitation, coordination, and clearances to see what information has already been or is being collected, and to possibly include some items in other ongoing assessments. Local authorities, including government, who should be informed about the plans for assessment, and communities, who should be engaged not only as participants, but as decision makers in the assessment. One way to do this is through a community committee who can input into the assessment's topic, methodology, and later the analysis and results. The module on engaging with communities talks more about community committees. Step 2. Collect existing information. Rapidly mobilizing existing information is extremely useful to focus the assessment and to guide subsequent programming. In-desk review can be done remotely or on-site and involves searching for, reading, and analyzing academic studies and grey literature, including scientific articles, field reports, books, and materials produced by humanitarian agencies. If resources allow, or if a strong partnership already exists, academic centers could support the desk review through their students and experts. In Haiti, after the 2010 earthquake, WHO commissioned a review by McGill University, which was ready within weeks after the catastrophe. And desk review brings together existing information about the cultural, social, political, and religious background of the affected communities relevant to a potential MHPSS intervention. Step 3. Mapping of existing actors. An assessment process can indicate what people perceive as needed. A mapping exercise is required to see whether these needs can be addressed with existing resources. Both are important to avoid overlooking a community's capacity to cope and respond to the situation. The Ask Reference Group on MHPSS in Emergencies has developed a 4Ws mapping tool, which is a matrix that records existing MHPSS resources, capacities, and services, literally who is where, when, and doing what. It is a helpful tool to identify geographical and thematic gaps, avoid duplications, and encourage coordination among humanitarian actors. However, it risks missing pre-existing active community-based resources and those that could be easily reactivated. These resources might include existing governmental services, churches, and traditional resources, volunteer groups, professional groups, and so on. These actors receive their funding from other sources outside of the humanitarian system and/or operate according to a different paradigm and so may be unknown to the humanitarian system. IOM can fully engage with the interagency 4Ws exercise whilst broadening its scope to these community-based resources. At the beginning of an emergency, mapping often happens through a snowball approach, where one actor will refer another and so on. The mapping should be seen as an ongoing exercise to continue throughout the life cycle of the assessment and the program itself. Step 4. Formulating objectives. The exact objectives of the assessment will depend on whether the primary aim of the assessment is of advocacy or to plan and direct intervention, the organization's mandate and actual possibilities to respond to the current crisis, the results of the desk review, discussion and inputs received from the members of the project's community committee and/or community gatekeepers. If the scope of the program is limited, for example, it can only provide urgent clinical services to people with severe mental disorders, then the goal should purely be to identify issues around this specific subject. This is important to avoid raising false expectations and contributing to any assessment fatigue. For IOM, the first MHPSS assessment is generally broad, aiming at understanding people's psychological reactions, their own perception of what causes these reactions, people's existing coping strategies at the individual, family, and community levels, and their understanding of needed services.
Step 5. Prepare assessment. The reading and activity will have you thinking about different assessment methodologies and tools. To recap, the methodology of an assessment should be based on the objective of the assessment, scope of the program, availability of time, availability of financial resources, availability of human resources, the informing logic or ideology of the intervention. As you have read, the assessment methodology determines how much participants and communities can freely express ideas, which is an essential aspect of community-based and participatory approaches. Existing tools vary in how far they allow for this. In emergencies, IOM normally uses an MHPSS Rapid Appraisal Procedure Toolkit that contains quantitative elements in the form of surveys, qualitative elements in the form of interviews and focus groups, and observations. The recommendation is that the MHPSS manager and their team tailor context-specific assessment methods and tools that consider the available resources and the scope of the program they can actually run. Tools can be transformed by adding or deleting certain items. Whatever method and tools are used, they should be adapted to the specific languages of participants, cultural context, and stage of the emergency. Words, phrases, and expression should be appropriate to the affected population's understanding, cultural practices, and belief systems. For instance, if feelings in a certain language only means physical rather than emotional sensations, there is a risk of misinterpreting the information collected. The adaptation process should be collaborative between the IOM national team, the project community committee or community anchors, and the IOM international team. It is then necessary to select target groups and interviewees. Participatory assessments are conducted with different members of the population to understand specific needs, resources, and capacities. This should include selection of participants should be random but with fixed minimum and maximum quotas for each subgroup. You can read more about purposive sampling in the manual chapter. It is then necessary to select and train interviewers. The size of the assessment team depends on the number and distance of the sites, the number of the participants, their location, the time frame, and the budget. When identifying staff, the following should be considered: technical expertise, personal qualities including communication, listening, and basic reporting skills. Context, where the assessment team is comprised of both host community and the displaced community members, or at least by professionals, cultural mediators, and or translators familiar with the local context and its language. This also ensures community involvement in the assessment team. Before the assessment starts, all interviewers need to be trained in interviewing and communication skills, documentation skills, analytic and problem-solving skills. Understanding of basic MHPSS issues, ethical principles, confidentiality, and informed consent. Psychological first aid to support the interviewees if needed, and the specific tools that will be used for the assessment. An important element of the training is ongoing supervision. Step 6. Data collection. A good collection exercise should include the following where possible: key informant interviews, semi-structured to allow for all full range of qualitative data, direct observation on the ground, meeting with the community stakeholders including religious leaders, teachers, and health workers, focus group discussion with those affected by MHPSS issues, their family members and relatives, community consultations. Assessment can include participatory mapping exercises aimed at identifying existing MHPSS services and human resources, and social network diagrams for camps, transit centers, and neighborhoods hosting internally displaced persons, refugees, and migrants. Different visuals such as photos, drawings, emoticons, and interactive exercises such as participatory ranking, voting, and community works can bring rich data and also allow children and individuals with low level of formal education to actively contribute. Step 7. Data analysis and discussion with the relevant stakeholders. Data analysis will largely depend on the methodology used. The manual chapter describes different approaches to analysis. Preliminary analysis and findings should be shared and discussed with the community representatives. These meetings can use visuals such as graphics, diagrams, drawings, and pictures, and should be attended by the assessment team, which includes experts or activists from the affected communities, the project community committee, or relevant stakeholders, including some assessment participants. Local leaders and representatives of affected populations, including representatives of the most vulnerable categories. A recent aim is to make sure that interpretations are in the line with community perceptions. It can also help identify local resources to be mobilized during the implementation phase. Step 8. Dissemination. Findings and data analysis should be disseminated with all involved, including NGOs, government, community and sub-community representative, and so on. Findings and data analysis should flag needs and available resources, bring actual programmatic recommendations, and include any obstacle and limitations. Findings should be shared in the local language and in culturally appropriate ways when possible. They should be shared with the ISK system, especially if there are recommendations for the other sectors to mainstream MHPSS, with academic partners and with identified gatekeepers and members of the project committee. Gatekeepers and members of the project committee can then describe findings and recommendations of their communities. This can be done to help facilitate the activation or reactivation of existing resources.